Hey everybody, Dr. Ziad Dadul here from fflockerroom.com, and welcome back for another Fantasy Football Injury Monday. And today we're going to keep it short and sweet and talk New England Patriots running back Dion Lewis. So yesterday news broke that Lewis is going to have a second procedure done on his knee, the same knee where he had his ACL reconstructed in November of last season after tearing it against the Redskins. And so what this usually means is that there's something structurally that seems to be hindering his ability to return to the field, hindering his ability to feel 100%. And typically there's three common things that we see with somebody having a second procedure. The first is just a minor cleanup, which was the term that was used, but essentially it means going in, cleaning up any debris, any swelling in the joint, anything that's impeding the ability of the joint to flex and extend, for him to be able to bear weight without pain. Maybe there's a catching sensation, something along those lines. They'll go in, clean it out, and it's typically a 4 to 6 week recovery, and which would put him on time for him to be back somewhere around the 6 to 7 week mark. That's the best case scenario. That seems pretty slim at this point, but that's our best case scenario. Second and more likely scenario is something going on with either the meniscus or the actual cartilage of the joint. And essentially what happens is, if the meniscus needs repairing, they're going to actually go in and stitch that meniscus back together. If there's a flap tear, if there's something that's getting caught in the joint, in the actual joint space that's limiting his ability to move properly. And that typically requires somewhere around a 4 to 6 week non-weight bearing period, followed by somewhere around 3 to 4 months of rehab and return to sport. And so that would all effectively ruin his chances of returning sometime this season, possibly sometime late in December, but really that's after fantasy season. That doesn't really do us any good. It does the Patriots a little bit of good, but not us as much. And the third case is, if there is actually cartilage damage or a cartilage defect that needs repairing, there's a surgery called microfracture surgery, where they actually go in, they poke these 1 to 2 millimeter holes to stimulate bone growth, to stimulate cartilage growth, to allow for the defect to be filled and resume more of a pain-free range of motion and weight bearing. And that's similar to a meniscus repair that requires somewhere around 4 to 6 weeks of non-weight bearing status, and then we're looking at somewhere around that 4 to 5 month return to sport. So those last two scenarios, they both effectively end his season, and we're going to be looking at him coming back for the 2017 season. Our best case scenario is somewhere around a 4 to 6 week return to sport. If it's only a cleanup and there's no actual structural damage or any structures they're going to actually have to repair. So, but they won't know. The surgeons will go in, they'll do the second procedure. Once they get in there, they'll be able to see a lot of what they can't see on the MRI. And once they get in there and they see what's going on in the actual knee itself, that's when they'll have a pretty good idea of what they're going to have to do. And so we're going to have to wait and see until some of the information comes out after that. So any questions about Dion Lewis? Any questions about anybody else as you head into draft week? I know myself, I have 4 drafts this week, so I know we're kind of getting close to that time of the year. So if you have any questions, use the hashtag AskDrZ. That's AskDRZEE on Twitter. And you can find me at Z_Dadul, or you can go to fflockerroom.com and find all of my injury content and all of our awesome writers that are putting out content on a daily basis. And so if you have any questions, let us know. Otherwise, go to fflockerroom.com for all of your fantasy needs. Until next week, see you guys then. Have a good week.